And we will move straight on to the next item of business. And the next item of business is a statement by Kate Forbes on the Scottish Government's response to the UK COVID-19 Inquiry Module 1 report. The Deputy First Minister will take questions at the end of her statement, and so there should be no interventions or interruptions. And I call on Deputy First Minister Kate Forbes. Up to 10 minutes, please.
Thank you, Presiding Officer. The COVID-19 pandemic affected every aspect of life in Scotland, and its impact continues to be felt. Today, as always, our thoughts are with those who lost loved ones. We understand that in recognition of the loss, hurt and suffering of the people of Scotland and the wider UK population, we must learn from past events and make effective, practical and measurable improvements in pandemic planning and preparedness. It's vital that we take steps to be as prepared as we can for the future. In July of last year, the UK COVID-19 Inquiry published its report and recommendations in relation to Module 1, which considered pre-pandemic resilience and preparedness. The inquiry's report sets out in detail its findings and the changes that it considers necessary to improve whole-system civil emergency planning and response in the UK, to ensure that we are better prepared for and able to respond to and recover from future emergencies. The findings and the recommendations in the Chair's report cover a range of matters, including governance and organisational structures, engagement and collaboration, risk assessment, including capacity and capabilities, the development of cohesive strategies to prevent, reduce, control and mitigate the effects of future whole-system civil emergencies, use of data and research, pandemic exercising, scrutiny, accountability and transparency, and how we support those who are most vulnerable to risks. We agree with the inquiry that changes are required in relation to these matters. Scotland faces a range of significant risks, ranging from pandemics to the impacts of our ever-changing weather. We must learn from past events and global best practice to ensure that we are prepared and ready. The changes that we've committed to will ensure that we are better prepared for future pandemics, but also that we're better prepared for and able to respond to a range of risks and threats and improve and strengthen our resilience as a nation. I'm pleased to say that today the Scottish Government has published its response to the Module 1 report and recommendations. Those affected by the pandemic, particularly those who bore some form of loss, have placed a great deal of trust in the Scottish Government, not just to take on the challenges that COVID-19 posed, but also to be open and accountable about our performance. That trust is of utmost importance to the Scottish Government and has informed all of our consideration of the Chair's findings and recommendations. The inquiry sets out 10 overarching recommendations. We've set out in our response, published online today, our commitments for action and the timescales which we aim to achieve them by. We'll provide regular updates to the UK COVID-19 inquiry to demonstrate our progress with regards to the 10 recommendations. My Cabinet colleague, Angela Constance, Cabinet Secretary for Justice and Home Affairs, as Minister with responsibility for civil contingencies, is already working across government to deliver the changes that we need. As we move forward, we must continue to work closely with our local, national and international partners to take the action needed to deliver on these recommendations. The changes needed to ensure our future preparedness cannot be made in isolation or by this government alone, which is why, first and foremost, we're committed to working collaboratively with the UK Government. We've already seen joint working with the UK Government and devolved governments of Wales and Northern Ireland to deliver a four nations concept of operations and exercise plan for a UK-wide whole-system civil emergencies, actions which address the findings and the recommendations outlined in the Chair's report. Recommendation 10 requires the UK Government to consult with devolved governments to create a statutory independent body for whole system civil emergency preparedness and resilience. We're committed to working together to ensure that any new body is able to deliver its function in a manner which respects the devolution settlement. Our partners beyond government are critical to delivering improvements on the ground, where the impact of emergencies is felt most starkly. We fully support the Chair's findings and recommendations regarding the vital role played by the voluntary, community and social enterprise sectors, and the role that they can play in building and maintaining our resilience. I want to pay tribute to the work of those organisations during the COVID-19 pandemic. Health boards, local government and Police Scotland, who are tasked with planning and responding to emergencies, were vital in the Scottish response. I also want to pay tribute to our communities and the third sector for the innovative and creative ways that they responded to the demands of the pandemic. As set out in our National Performance Framework, the Scottish Government is committed to tackling persistent inequality through our policies. A more equal society is better able to prepare for, respond to and recover from civil emergencies. Clearly, certain groups within our society are more susceptible and vulnerable to adverse shocks. And we know that the pandemic not only introduced new, but also exacerbated pre-existing inequality. We fully endorse the Chair's recommendations and will take action to improve how we identify, assess and address the potential impacts of whole system emergencies on the most vulnerable in our society. The UK Inquiry Chair has made clear her expectation that institutions take swift action to consider and implement her recommendations, to ensure that changes are in place as quickly as possible. We endorse this approach, and I'd like to reassure the people of Scotland that we have not been waiting for the Chair to publish before taking action on many of the issues raised by the inquiry. In August 2021, the First Minister established the Independent Standing Committee on Pandemic Preparedness to provide expert advice on future pandemic risks and how best to prepare for them. The committee provided its final report in November 2024 and covered a range of topics closely aligned to those in the inquiry's report, including effective data sharing and usage, the integration of behavioural science, improving connections between the academic and wider preparedness community, and the establishment of a Scottish Pandemic Sciences Partnership. We've already accepted the committee's recommendations in principle and will provide further details on our planned actions in due course. We've made changes to embed the reforms in public services and the justice system, which were necessitated by the pandemic, but also delivered improvements in the longer term via the Coronavirus Act 2022, which was passed in June of 2022. We've taken steps to increase and secure the types and levels of PPE items held in our national stockpile. On 4th of June 2024, Cabinet agreed to establish a new cross-government governance arrangement for future pandemic preparedness. Our newly established Ministerial Oversight Group, co-chaired by my colleagues, the Cabinet Secretary for Justice and the Cabinet Secretary for Health, will meet for the first time in the coming weeks. We've also commenced a programme of work to improve our risk assessment process, which better takes into account Scotland's circumstances and characteristics, including the impact that risks may have on the most vulnerable in our society. The Scottish COVID-19 inquiry, established by ministers in December 21 and which operates independently of the UK inquiry, will consider matters relating to pandemic planning and response as part of its examinations, and will consider those findings when they are available. Given the importance of transparency around the actions that we are taking to manage civil emergencies, we will also report to this Parliament every 3 years on the improvements we make to emergency resilience and preparedness in Scotland. The first report will be laid before this Parliament in September of this year. I'd like to reiterate the Scottish Government's commitment to continue the highest standard of cooperation with both inquiries, because learning from them is vital. Before closing, I'd like to note my gratitude to those working in both the UK and Scottish COVID-19 inquiry and those who have provided evidence to those inquiries. I am conscious of the immense responsibility they hold, the enormity of the tasks they face in understanding and distilling the events of the pandemic and the important lessons for the future. And I'm happy now to take questions. Thank you.
Thank you, Deputy First Minister. The Deputy First Minister will now take questions on the issues raised in the statement. I intend to allow around 20 minutes for questions, after which time we will move on to the next item of business. I would invite those members who would wish to ask a question to please press the request to speak buttons, and I call Sandesh Gohani.
A declaration of interest as a practising NHS GP, both now and during the pandemic. The COVID-19 report casts serious doubt on the Scottish Government's ability to address key failings from the pandemic. One major concern is the lack of detail on how the Scottish Government plans to overhaul risk assessment and pandemic planning. The SNP needs to act decisively to update frameworks to respond to new threats and run regular scenario tests. Transparency is another issue. Regular bedtime deletion of WhatsApp messages means we will never know the reasoning of centralised decision-making and the lack of involvement of key stakeholders. The pandemic exposed stark health inequalities in Scotland's most deprived communities and those most vulnerable. And without clear leadership and meaningful reform, the SNP risks repeating past mistakes, leaving Scotland unprepared for the next crisis. The Deputy First Minister talks about adopting a UK-wide strategy, but this sounds hollow given Ms Lloyd, Nicola Sturgeon's Chief of Staff, wanted, and I quote, a good old-fashioned rammy with the UK Government. Whilst the rest of the UK was developing an NHS app, the SNP Government decided Scotland would go its own way for the sake of being divergent. How can we avoid this divergence in the future of policy and continue to work in a four-nation report? And we watched the relentless march of COVID across Europe and knew the vulnerable groups that would be most affected, and yet inadequate protocols were in place to protect them. What will the Scottish Government do differently next time?
Well,
Deputy First Minister.
Thank the member for those series of questions, and I hope that in slower time, as he rereads perhaps our response to the Chair's report in the first place, he'll see just the way in which we have set out very clearly our acceptance of the recommendations that have been made by the Chair, but also the fact that we have attached very clear actions and timescales to each of our responses. He mentioned three particular points, one of which was essentially pandemic exercises. And recommendation 6 talks about a UK-wide pandemic response exercise every 3 years. That's a direct quote from the Chair's requirement. So rather than us suggesting that it's our response, in fact, that was the recommendation from the Chair. And we are committed to participating in the Tier 1 national exercising programme, which seeks to exercise responses to a range of risks rather than just a pandemic, to make sure that we are prepared for any eventuality, because I'm sure as a practising GP he will know that these risks come in all shapes and sizes, and many of them are difficult to forecast. A number of other points in terms of risk assessment he mentioned, which is recommendation 3, a better approach to risk assessment. And we have accepted that recommendation. We will continue to improve the approach to risk assessment, and we are going to take a joined up approach with the other UK nations. He also suggested improvements on transparency, and that's recommendation 8. Again, we have accepted this recommendation in principle, and we have agreed to regularly reporting, and I already set out the timescales for the first report, which will be laid in this summer. So rather than wait indefinitely, we've also set out a very clear timescale and would expect Parliament to scrutinise that first report. Thank you.
I call Jackie Bailey.
I thank the Deputy First Minister for her statement, and I welcome that all 4 nations are working together to improve resilience and planning for future pandemics. There are many lessons that need to be learned, and I want to focus on just 3 of them. Firstly, let me welcome the 3-year reporting to Parliament, because given the lack of planning and scrutiny in the past with Silver Swan, this will be a definite improvement. Secondly, I think she would acknowledge that trust is important, and therefore openness and transparency must be our watchwords. So more than just principle, but also practice, can the DFM tell me that the wholesale deletion of WhatsApps by ministers and civil servants, including John Swinney, will not happen again? Thirdly, and finally, we know that risk assessments were not undertaken when the Scottish Government gave the green light for health boards to discharge patients untested into care homes, so that COVID-19 spread like wildfire amongst the most vulnerable. Can she assure the Chamber that actions like this will be fully risk assessed in the future?
Cabinet Secretary, Deputy First Minister.
Thank you. Well, on the point around WhatsApps and the use of mobile phones, that's an example of how the Scottish Government has responded in advance of this statement today, because we have set out, as she will know, a new policy when it comes to the use of WhatsApp, that corporate devices will not be able to access WhatsApp, and we have, as a result, and in response to Emma Martin's review, set out a new policy framework for the use of mobile messaging. She talks also about the importance essentially of health resilience, and that is captured very much in the report and in our response. And as I said already, we have been taking a lot of steps to improve the resilience of our health system, to deal with any pandemics in the future. And there is a number of points that we have identified in our response to the Chair. Some of that relates to PPE stock supply, distribution and training. But we also are looking to work with the UK Government on areas of joint surveillance and recognising that the 2011 UK pandemic flu plan was not fit for purpose. So there's just 3 examples of ensuring that across the health service there is greater resilience, and they are prepared and they have the capacity to respond in future. In terms of the reporting to Parliament, I note her welcome of that commitment to report to Parliament, and I do think it's really important that we do this on a joint UK-wide basis, which is precisely why I believe, unless someone corrects me, all of the 4 nations are responding simultaneously this afternoon.
I would advise members that obviously a number of members wish to ask their question, and to get as many members in as possible, I would need to have succinct questions and answers to match. I call Stuart McMillan to be followed by Brian Whittle.
Thank you, Presiding Officer. It's undeniable that there are profound lessons to be learned from the effect of health inequalities during the pandemic. Can the Deputy First Minister outline how these inequalities will be addressed as part of the public health planning moving forward in response to evidence shown in the aftermath of the COVID-19 pandemic?
Deputy First Minister.
Well, increasing healthy life expectancy and reducing health inequalities across Scotland is an ambition of this government, and we recognise that health inequalities in Scotland have widened in recent years, in part due to a number of issues, but particularly COVID-19. We're developing a population health framework which takes a cross-government approach to improving the key building blocks of health, including population health and the reduction of health inequalities. And this issue is very prevalent in the report from the Chair and in our response to the recommendations.
I call Brian Whittle to be followed by Claire Adamson.
Thank you, Deputy Presiding Officer. I think the rapid development and deployment of technology during COVID was key to the management of the pandemic and demonstrated that governments can be agile and active when the need arises. However, despite this, healthcare technology and telemedicine development have fallen back into the slow lane. So what will the Government do to ensure that the demonstrable benefits of technology deployment, especially in an emergency, including data gathering and sharing, are fully realised?
Deputy First Minister.
The member makes a very good point, and data is included as recommendation 5 and research for future pandemics, and we accept that recommendation. We're fully committed to working with the UK Government to ensure that we have reliable data and research for future pandemics, both for Scotland and on a four nations basis. So that is a recommendation which we have agreed to in full.
I call Claire Adamson to be followed by Carol Mockin.
Thank you, Presiding Officer, and thank you to the Deputy First Minister for her statement. Can I recognise the comments that have been made about the people who lost their lives during COVID and acknowledge that along with the others in the Chamber today? Scotland did have a response to the pandemic that included the third sector in many ways, and I was wondering, as the Government has already committed in the statement to the significant improvements in pandemic preparedness within social care and health, what help will also be given to ensure that our third sector can rise to those demands going forward?
Deputy First Minister.
Well, I think Claire Adamson is right in acknowledging the work of the third sector during the pandemic, but also in response to a number of the inequalities that were exacerbated during the pandemic. I referenced their importance in my statement, and we also accept that in terms of being prepared, that work needs to go on beyond the boundaries of government, and we will continue to engage with the third sector and others in ensuring our preparedness for a further risk.
I call Cara Mockin to be followed by Rona Mackay.
Thank you. I thank the Deputy First Minister for her statement today. I also welcome the Four Nations approach being taken. For lessons to be learned, a collaborative approach is vital. As the Deputy First Minister has said, during the pandemic, certain groups within our society were particularly vulnerable, and COVID only exacerbated pre-existing inequalities, and more work must be done in this. So can I take this opportunity to ask the Deputy First Minister to assure Parliament today that the Scottish COVID inquiry will investigate the issues around inequalities and bring to light the injustices felt by some of the most vulnerable in our communities? And can I ask about what timescale we might expect some of this work to come under?
Deputy First Minister.
If I heard the member correctly, she asked for reassurance on what the Scottish COVID inquiry would do. And as she will know, it's really important that the Scottish COVID inquiry are entirely independent of government. So it would not be appropriate for me to determine or to guide the areas that they choose to explore. But I imagine that these issues that she has identified are issues that will inevitably be explored because they're of such importance in our understanding of the impact of the inquiry.
I call Rona Mackay to be followed by Gillian Mackay.
Thank you, Presiding Officer. The Scottish Government has openly supported continued innovation in life sciences and public health research for the development of diagnostics, vaccines and therapeutics to provide the capability to respond to novel threats when required. Can the Deputy First Minister outline what investment will be made in this sector in the Scottish Budget 2025-26 and how this will benefit Scots across the country?
Deputy First Minister.
Well, the member is absolutely right that life sciences is not only a critical driver of growth in our economy, it is also potentially life-saving because it provides life-saving therapies and contributes very significantly to that. So we have set out measures in our programme for government to grow the sector. At the moment, it contributes more than £10 billion to the economy, supporting 42,500 jobs. And as part of our enterprise package, we will continue to support innovative and high-growth companies that operate in the life sciences sector.
I call Gillian Mackay to be followed by Alex Cole-Hamilton.
Thanks, Deputy Presiding Officer. This is the first module of 10 that will complete over the next few years. The inquiry is essential and it cannot be rushed, but the recommendations should be worked on at pace. And I'm grateful to the Deputy First Minister for setting out how that's being done at the moment. However, pandemics don't wait for us to complete work, learn lessons and then implement them before happening. So how confident is the Deputy First Minister that if we were to have another pandemic in the short term, that we would be ready without the full learning from this inquiry?
Deputy First Minister.
Well, as the member said, we can't afford to wait, and I set out in my statement the a number of steps that we've already taken in advance of the Chair publishing the report and of our response to the recommendations. I mentioned that the Pandemic Preparedness Group that was established had published its recommendations last year. Many of those recommendations are similar to what the Chair had recommended, and we have made significant progress on those recommendations already. So much of what we have responded to is already in train. Those areas that require Four Nations responses are probably the items that are new in this particular response.
I call Alex Cole-Hamilton, followed by Emma Harper.
Thank you very much, Presiding Officer. I'm sure the Chamber is reassured to learn that the Government will maintain an adequate stockpile of PPE. Can the Deputy First Minister firstly reassure the Chamber that this stockpile will be refreshed so that no staff are opening out-of-date face masks and gowns in the event of another pandemic, and that we use this time between pandemics, and we must think of it in those terms, to ensure that there is an adequate mix of masks which are fitted to all face types, genders and body types, so that we don't have a situation again when a predominantly female workforce were unable to use face masks designed for men. Thank you.
Deputy First Minister.
Well, in terms of PPE, we continue to hold a national stockpile of PPE items and we are updating regularly those items held in the stockpile to reflect the learnings from the COVID pandemic, and all of that is reviewed regularly as part of a Four Nations planning and preparedness exercise. The Scottish Government has recently commissioned a review into the current and future arrangements for face fit testing of FFP3 masks in health and social care settings, and will consider the findings of this review once available. But just to reassure the member and others, NHS National Services Scotland, who manage the storage and distribution of PPE items on behalf of the Scottish Government, are working continually to improve all arrangements and to ensure that PPE items are available at the point and time of need and the appropriate PPE.
I call Emma Harper to be followed by Jackson Carlow.
Thank you, Presiding Officer. Throughout the COVID-19 pandemic, thousands of nurses and other healthcare professionals across Scotland administered crucial vaccines to the wider population. And I remind Chamber that as a nurse, I was part of Dumfries and Galloway's vaccine team during that time. The vaccine programme was one of the most pivotal moments in tackling the pandemic, reducing harms and deaths and enabling a return to a certain level of normality, reuniting friends and family by enabling safe socialisation. So can the Deputy First Minister therefore speak to what lessons have been learned by the Scottish Government on the medical response to the pandemic, particularly through the vaccine and testing programme, and how this will enable better planning and pandemic preparedness in the future?
Deputy First Minister.
Well, the public hearings of the UK COVID-19 inquiry covering vaccines and therapeutics are currently live, so it wouldn't be appropriate for me to comment on evidence presented there. But we have conducted evaluation studies of our vaccination and testing programme, and in January last year, January 2024, we transferred operational oversight for vaccines to Public Health Scotland to ensure roles and responsibilities are clear and understood in the event of future emergencies. One of the examples of the changes that we have made. One significant lesson learned from the pandemic in relation to vaccines was around the availability of a workforce to administer these vaccines, and I thank all those who participated in distributing vaccines, and our vaccine teams are now larger than they were pre-pandemic.
I call Jackson Carlow to be followed by Willie Coffey.
Of course, the previous pandemic to this one of any significance was the Spanish flu epidemic, pandemic 100 years before. So it's perfectly possible we'll all be dead and gone by the time of the next one. Notwithstanding that cheery thought, institutional memory is a fickle thing. And it's perfectly possible there will be no first-hand memory to draw upon. Is the Deputy First Minister therefore certain that the processes and procedures that are being put in place will survive the test of time?
Deputy First Minister.
Well, I think the member is absolutely right to identify the importance of institutional memory and the danger of only relying on institutional memory, which is, I think, why our Four Nations response is so critical, because it then writes it in essentially to the four institutions that govern these islands. One of the recommendations, for example, is a much simpler structure for responding to whole system civil emergency preparedness and response. And I would argue that things are always easier to remember if they're simpler than if they're overly complex and bureaucratic. So, irrespective of what the future holds, we understand our responsibility to be prepared, and we are committed to taking the lead on that.
And Willie Coffey.
Thank you. I understand that as part of the report there has been a UK-wide call for a national laboratory for pandemic preparedness. And I note that the Scotland Standing Committee has urged the creation of a centre of pandemic preparedness in Scotland. Could the Deputy First Minister outline the Scottish Government's work on this so far and when the delivery of this might be expected?
Deputy First Minister. Well,
we have accepted the recommendation in principle, and we'll work with partners on how to deliver that. The member is absolutely right that in its final report published in November, the Independent Standing Committee on Pandemic Preparedness made a series of recommendations relating to the use of data governance, funding and relationships between the private, public and academic sectors. We have accepted that recommendation. We are developing next steps, and I would be very happy to update Parliament in due course.
Thank you, Deputy First Minister. That concludes the ministerial statement, and there will be a short pause before we move on to the next item of business. Thank you.